So conventional treatment of Lyme is basically antibiotics. Here in the U.S., the CDC recommends if there's a known deer tick bite, you saw the tick, you pull yourself, is to take a single dose of doxycycline. It's interesting that when you look at the research, they've never shown that the single dose of doxycycline actually prevents Lyme disease. What it can do is suppress the Lyme rash. And since the Lyme rash is that one thing that would actually prove that you do have Lyme, that's almost counterproductive. So those of us in our world who treat Lyme would never use a single dose of doxycycline. If we're going to use antibiotics, the CDC recommendation is 10 to 21 days. Now, remember, Lyme is a slow-growing organism, right? Every 1 to 16 days. So in that 21 days, Lyme may have only gone through one replication cycle. So if you don't know, doxycycline is an antibiotic that does not kill the organism. It stops it from replicating. So it may only stop it from replicating one time during that course of treatment. That doesn't sound very effective. So I think if you're going to use antibiotics, 6 to 8 weeks is usually the minimum. And again, you're going to base it really on how people respond to it. But this idea that you're going to get rid of Lyme in just 10 to 21 days is not as likely. You may bring that organism down a little bit, but I've seen people who went through conventional treatment and then some months, years later, they start having problems again because they probably knocked it down, but never knocked it out completely. So for people that don't tolerate doxycycline, there are other antibiotics that are available, amoxicillin, cefuroxime. In children, again, they recommend these antibiotics based on body weight. Interestingly, there's actually no recommendation for children under 8 years old for acute Lyme disease. Kind of interesting. So, the good of the antibiotics, again, is a lot of people, if you treat it early, the antibiotics do their job and you can, get rid of it. And that's the end of that. It can be really effective in these early stages of Lyme. And often their symptoms are gone and they never get a relapse again. Some people, even if they've been exposed a while ago, the treatment regimens can help. And again, for people who do clinically feel better on antibiotics, that's also kind of proving your point that there is an underlying infection. Interestingly, a lot of people with Lyme disease will tell you that when they got when they got antibiotics for something completely unrelated, they had bronchitis, they had dental work, they had a sinus infection. They're like, man, I went on that course of antibiotics and my joint pain went away, my energy got better. So again, when we hear this history, we're pretty suspicious that there's still some other organism that was unrelated to whatever infection they were being treated for. And of course, the bad side of this is that you can get a die-off reaction. It's called a Herxheimer reaction, and we'll call it herxing. And these are flu-like symptoms that can occur as the organism is being killed. And this can last days to weeks. It should last really no more than probably 10 to 14 days. If it lasts longer than that, it's not a die-off reaction. That means you're having a problem with whatever you're taking. It can happen with antibiotics. It can happen with herbs. It's a lot more common with antibiotics, but people need to prepare that that can happen when you're undergoing treatment. And of course, nowadays, a lot of doctors are using combination of antibiotics. The more you add to the mix, the greater likelihood of side effects, nausea, vomiting, loss of appetite, diarrhea. You can't kill the bad stuff without killing the good stuff. So inevitably, your normal, healthy microbiome is going to suffer. And of course, long-term antimicrobial use can cause liver damage, organ damage, suppress the immune system, cause other issues that you would want to monitor closely. And of course, the ugly part of this is that you can get something like a C. diff infection, yeast infections, and now you got to need stronger antimicrobials, antifungals. Again, some of these cause immune suppression, and now that's supposed to due to other infections. And I don't know that we fully understand the long-term effect of using antibiotics like that. When you disrupt your gut microbiome long-term, now knowing that the gut is so much tied into all these other illnesses, does it dispose to autoimmune disease, leaky gut, allergies, heart disease, diabetes? We don't really know the truth. So let's talk about my world now, and let's talk about the natural treatment for Lyme disease. How can we navigate this without necessarily having to pound ourselves with hardcore antibiotics and only really target the bug? I am of the opinion that Lyme is an opportunistic infection. I think there's a lot of people around the world that get exposed that never get the clinical symptoms. And so we kind of get into this argument of, germ theory versus terrain theory. Is it the germ or is it the terrain? And I think we saw this with COVID, right? We saw some people that got a sniffle and some people that died. If we believe that the germ itself is at least relatively the same at any given point, why doesn't everyone get impacted the same way? And I think Lyme is the same thing. It's like not everyone's going to have the same clinical experience when they get exposed. And I'm sure if I tested everybody in New England, we would probably find 70% of people have antibodies against Lyme, and they don't all have Lyme disease. So what is it about the person? What is it about the terrain that allows that organism to become opportunistic and be problematic? So first and foremost, I always think about diet and gut being the foundations of good health for really any chronic illness, and Lyme disease is no different. If you're not eating the right foods and if your gut isn't functioning the way it's supposed to, it's going to be harder to get well. Your gut accounts for up to 80% of your immune function, and knowing that those microbes play such an important role in metabolism in your immune system, again, if that's off, it's harder for everything else to work the way that you want it. So there's a lot of diets out there that promotes various health benefits. What I found is that people with Lyme disease tend to do well when they consume what's called an alkaline diet. Alkaline diet is nothing new. It's nothing I invented. There's books written back in the 1950s, 1960s talking about an alkaline diet. And what that really means is that as food breaks down in your body, it can make your cells alkaline, it can make them acidic, or it can be kind of neutral. And we know that blood pH is very tightly regulated. One of the criticisms people have is like, well, an alkaline diet doesn't change your blood's pH. I'm like, you're right, it doesn't. And that's not the point of it at all. But we've got ample evidence that it can change cell pH. And that's really what we're targeting. So your stomach, your skin, your bladder, for women, the vaginal area, these are very acidic. These are designed to help protect against outside invaders, but the rest of your body is more or less alkaline. So we know that your cells function best in an alkaline state outside of those tissues. So the way I break it down is really into three categories. And again, there's lots of resources out there on this. Fortunately, most vegetables are alkaline forming. So again, this is not about the pH of the food. This is about how it breaks down your body. So for example, lemons and limes are acidic. The fruit themselves. If I squeeze lemon juice on pH paper, it's going to turn the paper acid. When I drink lemon juice, as it breaks down the body, it makes my cells alkaline. So again, this has nothing to do with the pH of the food. This has nothing to do with changing blood pH. This is really about how do we modulate your intracellular pH. So again, this list of foods, you can eat as much as you like, pretty much. Again, these are very alkaline forming foods in the body. Other nuts, seeds, grains, legumes, oils, all of this, again, can help make your body very alkaline. The second category is, okay, you can eat these foods, but I'd probably keep your intake down to about 25% of your dietary intake. So it's not like you can't eat them. These are foods that are either kind of neutral pH or slightly acidic. What we see on this list is a lot of fruit and really all animal protein. So, the best way to think of category 2, if you look at your plate and divide it in quarters, it really shouldn't fill up more than a quarter of your plate. So again, you can still have your, free range, chicken and grass-fed beef and eggs and all that. Again, it just shouldn't fill up more than a quarter of your plate. And then these are foods I would really recommend to stay away from. These tend to be very acid forming. Dairy products, all the refined processed foods, a lot of, your sweet condiments, anything that really, of course, has a high sugar content. Of course, all your bad like seed oils. And then, of course, the one that's a tough one for a lot of people is coffee. Coffee, for a lot of people, can be very acid forming. Now, in saying that, there are low acid coffees out there. So you can always maybe try that and see how it goes. I know when I was in the throes of Lyme disease, and I love coffee, every time I drink coffee, my neuropathy would get worse. And I, start it, stop it. And it's very obvious that that was causing a problem. Now I can drink coffee and it doesn't bother me, but that took a long time to get to that point. The best way to monitor this is that if you buy some pH paper at the pharmacy, 30 to 60 minutes after you have a meal, go pee on the strip and check your urine pH. We want your urine pH between 7.2 and 8.0. If you can kind of get that target, then we'll know that metabolically your body is processing this food in the way we want to change cell pH. Don't ever bother testing your first morning urine pH. You make ketone bodies when you're fasting overnight. Your urine in the morning is always going to be acidic. That's not helpful. But 30 to 60 minutes after you eat, and you find over a course of time, you'll know pretty quickly if you're on target with how your body's responding to the diet. Herbal treatment of Lyme disease. So in lieu of using antibiotics, I am very much in favor of using herbs. I'm a naturopathic doctor by training. Herbs are in our wheelhouse. And why would this be a better option? Well, I think for a lot of people, they are safer. They come with less side effects. And, even if people have an issue with herbs, those tend to be relatively mild relative to what an antibiotic can do, particularly to the gut. I also think herbs have very broad clinical activity. If you look at the constituents of plants, they're complex. They have a lot of different components in it, where an antibiotic is one chemical, it's one thing, where herbs may have 8, 10, 12, 14 different things that some of those constituents can be antimicrobial, some are anti-inflammatory, some are soothing to the mucous membrane, some boost your immune system, some promote better blood flow. So I like this idea that we can mix and match different herbs based on your symptoms to address this broad scope of what Lyme has done to your body.